Hello, this is Michelle from Physioactive with another episode on our Medical Insights series. Nowadays, we all claim to watch what we eat and even try to improve our eating habits. The South Beach diet, Paleo diet, Atkins diet, Keto diet are probably known to you. It may also be known to you to choose a diet that is sustainable and suitable for your body's needs. Today, we will discuss how to incorporate anti-inflammatory foods into our existing diet. We have with us Simran Nanwani, registered nutritionist, to tell us more about this. How are you, Simran?
Hi, Michelle. I'm well, thank you. Thank you so much for having me with you today.
Please tell us a bit about inflammation to begin with and what causes inflammation in our body.
So, to answer your question, Michelle, inflammation is a process by which our body's white blood cells, which are our immune system, they react and respond to protect us from infections or any foreign invaders that enter our body that's not meant to be there. So, think of it as it's a defense mechanism from our body to protect ourselves from things that are not meant to be there. And there are many different causes of inflammation. It could be triggered by things like pesticides, your environmental factors like pollution, dust, dirt, so many other factors like food. Like sometimes we consume, they call it the non-nutritious foods. Why is it not good for us to have too much of that as well? So it's about understanding how to get a healthy balance. And a lot of factors causes inflammation. The thing with this is that it can manifest into many different chronic conditions. So before even developing into, let's say, heart disease, arthritis, joint pain, fevers, allergies, all these asthma, all these disorders, all these conditions all start from inflammation. Naturally, our body is designed in such a way that it can manage day-to-day things, but if there's an overdose of it, and we're not giving our body enough time to heal and recover from all of that, then it goes out of balance. I'm going to get into a bit of psychoneuroimmunology. When we experience any sorts of inflammation, we produce inflammatory cytokines. And there are three primary cytokines that we produce. It's interleukin 1, interleukin 6, and tumor necrosis factor alpha. So when you start to feel like on a day you just wake up and you're like, oh, I can't get out of bed. When you start to feel fluish or when you feel under the weather, you can't really define it, but your body is telling you, I really can't get out of bed, just stay in bed. That's because you have high levels of interleukin 1.
Okay.
When you have higher levels of interleukin 6, it's when you start experiencing a sort of anxiousness. And when people get a flu and when they're sick, sometimes they're just horrible to be around, right?
Mm-hmm.
That's your body's way of naturally making people stay away from you so that you don't spread the virus infection or anything. So that no one wants to be around you. If you don't want to stay in bed, if you don't want to just keep contained to yourself in your room, your body starts to make you react and behave like a horrible person such that no one wants to be around you. And that's when you have high levels of tumor necrosis factor alpha. So our body is already designed in such a way where when there's inflammation, you won't be able to think very clearly. You will feel tired a lot of times. You just want to stay in bed. You just feel on edge. You just feel heavy. You feel like a lot of things that sometimes you don't even know what to call it. You won't even associate it with something. You're just like, this is normal. And you're like, no, it's not normal.
What is the important foods that we can include in our diet to help optimize anti-inflammation?
Actually, it's not just food. So I'm going to incorporate a few elements here. There are some things like your fresh vegetables, washed properly, cleaned properly, your omega-3s. These days, our ratio of omega-3s to omega-6 is gone off the roof. So normally we'd have more omega-3s and omega-6s, but these days we have more omega-6s, which are all your processed fats and all of that, compared to the healthier fats, which is omega-3 that we need. So getting your omega-3s from your nuts and seeds, your fish, your beans, your legumes, making sure you eat enough vegetables. I feel like I can't emphasize on that enough because over time, the way the agricultural, from the agricultural sector, the nutrition of vegetables over time have declined, right? Like for example, carrots are 1,000 times less nutritious today as it were 100 years ago. So that's just telling us that, okay, since it's less nutritious, we actually have to eat more of it.
Okay.
And in comparison to everything that we eat, vegetables is not a very dominant meal on the table. That's something I've started to notice and observe amongst when you go out, when you're eating out, when you're noticing families and friends and things like that. So it's very important to make sure you incorporate enough vegetables. Like half your plate should be filled up with vegetables, a mix of non-starchy vegetables, which are your green leafy vegetables, and also your things like carrots, sweet potato, and all of that, and making sure you have enough fruits, your non-gluten grains. These days, gluten is such a big problem, and I feel like it's gaining more awareness. It's important to again recognize that it's not necessarily the gluten that's the problem, it's how the gluten is being processed, how the gluten is being treated. So a lot of people have reactions to the pesticides that's used. It's called glyphosate. So it's a pesticide used to treat gluten, and that's something people actually react to. So more and more people are thinking that it's gluten that's the problem, but actually it's a combination of things around there. So that's why they're like, okay, if this is troubling you, just slowly don't make that the center of your meal.
Okay, so you speak about nuts and you speak about vegetables. What about proteins?
Yeah, so I'm just coming to that. I want to talk and emphasize about the healthy fats and oils, which we talked about, from olives, olive oils, and then you go into your protein. So you've got your meats, your eggs, your nuts and seeds, beans, legumes for those who are vegan or plant-based. Make sure you get enough of that. A lot of times we are under eating, especially for vegetarians and vegans, we're not consuming enough proteins. And then on the top, think of it as a pyramid where you enjoy your healthy treats on top. So whatever you want, it's all about a balance, right? At the end of the day, no one's saying you can't have that cake. No one's saying you can't have that piece of chocolate. Enjoy it, but look at the structure again, keeping your vegetables, your fruits, your grains as the base. As you go up, you have your proteins, and then on the top, allow yourself to enjoy life a little, because you are going to go out with people, because food is also a sense of bringing people together, right? And
Okay.
it's just about understanding how to pick and choose what's good for you. Like even when you go out, order a plate of vegetables to share with everybody. We've all experienced cravings, right?
Mm-hmm.
And sometimes we eat so much that we're just so full towards the end. Sometimes your body craves for a reason. Your body craves food because it wants to satisfy the nutrient requirements that your body is asking for. But if we're going to give it a bar of chocolate and you're still hungry, you have another bar of chocolate, your body will still be hungry because it's asking for nutrients. So you're still going to keep getting that urge to eat until you satisfy all the nutrient needs. So why not start with a nutritious bowl of vegetables and whatever, satisfy that nutrient needs, your body hits that satiety level, and eat whatever you want after. You'd feel full just like this without realizing that, okay, I'm actually full. I don't, I'm not craving more food. So it really helps with a lot of things because you're satisfying the nutritional needs first, and then everything else sort of just balances out automatically rather than having supplements to counter that, a lot of times people are just like, okay, I'll just take supplements, I'll be fine, I don't need to worry about what I eat.
And as a role of a nutritionist, alongside working with patients at our physio clinic, how would you program or guide our patients toward their goals?
How would I guide them with their goals in the terms of food? Again, depending on what their primary needs are, because sometimes people who are people who are on the overweight end of the scale, naturally they produce more inflammation. So we need to manage that first and then work towards, let's say, what are their goals after? Like what are they after? Are they after building muscles? Are they after relieving joint pains? Because if you're working towards relieving joint pains, like I love incorporating turmeric. But again, there are different types of turmeric used for different people, depending on whether or not it suits them. So it's a very personalized program, and you can't use the same diet for everybody. You have to understand what works for one may not work for the other. For example, food allergy and food hypersensitivities. A lot of times we don't realize that what we eat is actually affecting us internally, and it could actually manifest and cause things like joint pain. And that's something we don't often see the connection. So it's really important that we realize that each diet, as we call it, so when I refer to diet, it's not one of those fad diets, but what we consume and what we do on a day-to-day basis, it's personalized for each individual. And we really need to recognize what suits our body and what does not. So sometimes, let's say, fresh yellow turmeric is not something that suits everybody. From an Ayurvedic perspective, it's a very heaty type of herb or spice, right? So there's other alternatives like white turmeric that can help with that. So it's more of a cooling turmeric that has the same benefits as yellow turmeric. And another hack would be, instead of having a fresh one, have the powdered one. So there's always different ways to incorporate anti-inflammatory herbs and spices to help with that. And we've always heard about MCT oil, right? Your coconut oil, having that in the morning with your coffee, with bulletproof coffees and things like that. You've always also heard about ghee from an Ayurvedic perspective. So there are so many different reasons why we do that. For example, why would someone have a spoon of oil in the morning? People are like, you'll gain weight with it. Oh, it helps with weight loss. It helps with this. Ditch all of that. Actually ask, why do we need it? Again, it's a source of your healthy fats. It has anti-inflammatory properties. Number two, you put moisturizer on your skin. Why not do the same internally? One more thing that is very, very important to clarify is that everyone thinks, oh, I'm about to fall sick, let me load up on vitamin C, right? Actually choose to do vitamin D instead. Vitamin D works very well to activate your immune system and regulate your T-reg cells, which are your T regulatory cells, and helps to balance your immune system. So yeah, so prioritize getting some sunshine in your vitamin D more than your vitamin C. Vitamin C is great, yes, but vitamin C is actually an antioxidant. It's actually more beneficial at the end of an infection rather than the start. Again, you have to talk about balance. If we're experiencing more stress levels in our body that causes inflammation, again, on top of that, you have the pollution. On top of that, we're eating foods that are causing more inflammation. Our inflammation goes there, and what are we doing to help offset that? We're doing this much. That's not enough. So at the end of the day, it's about mastering what can help you balance that out. It could be like going for a walk in the sun. That's anti-inflammatory as well. Spending time in nature, doing a bit of breathing practices, practicing a bit of yoga, meditation, relaxation, all of that helps to reduce inflammatory levels as well. So it's a matter of looking at it holistically, and food, yes, plays a big role because that's something that's really in our control. Getting to all the other lifestyle habits as well is important. And again, it's finding the equation that works for you. And what works for you today, you have to find a variety of tools or have access to a variety of them so you know what suits your day every day. Because every day, maybe you feel different every day. So it's about mastering that. Okay, I have this tool today, let me try do a bit of this today. Okay, I don't feel like doing this, let me do something else that sort of aligns with this as well. So that's why working with a professional helps, because the professional can share with you the different techniques and then you can choose to apply it as and when it suits you, so that it's more sustainable. You're likely to do it and you get the overall benefits of it. And sleep is also a big factor. Are we sleeping enough these days? No, because our mind's racing at 1,000 miles per hour. So how do we work with all of these factors to help with that? And then a lot of people are like, oh, I'm so stressed, let me go for a HIIT workout. You don't realize that's adding more stress into your body, causing more inflammation in the long run. So it's about, again, understanding all of these different things that can contribute and finding what works for us. And what works for me will be very different to what works for you.
Okay, thank you so much for this information. For our viewers, if you may wish to make an appointment with Simran, you can call Physioactive at +62 811 8897 970 and we can assist you with connecting with her.